Mark's good set. Go.
Hello.
Hi.
I'm just one of the pre-assessment nurse. I'm just going to do some pre-assessment and take some history about you. Is it okay with you?
Yeah.
If any problem, just let me know and I'll stop it. And okay. Okay. So you're going for some surgeries. You decided to. Do you know what it is? What's that surgery?
I'm having some bit of bowel taking.
Yeah, your right side, some hemicolectomy going to do. Okay. What's the problem at the moment? What the problems with you?
I went to the doctor and I was having some pain and I've had some diarrhea. So about 2 weeks I've had some pain and about last week I've had some diarrhea as well. And I also had lost some weight as well recently.
Mm-hmm. Right. Is it the pain only in the one side or anywhere else?
About 2 weeks. No, about a month.
Yeah, mainly on the right down.
2 weeks before I went to see the doctor.
Okay.
Yeah, it's down here.
Is it making when it's going worse, or is it all the time the same pain, or what's making you?
The pain's just pretty much there all the time.
Right. You taking any medication for anything for the painkillers, anything like that?
No.
I'm really feeling really tired. I was missed sleeping a lot.
No, I haven't been given
I'm trying to
anything
get
to take for it.
I'm just not feeling my normal self. Yeah, I suppose hang on me now. About 2 stone.
Okay.
Over the last few months, probably.
How much is the pain? Like if you say 1 to 10 scale, how much you feel, all the time? Is it like a bit severe pain, or
Yeah,
like
it's very severe.
how much you think?
Probably 8, 7, 8 out of 10.
Right. Is it during the night time the pain there? Still when you taking rest, or all the time?
All the time,
Is
yeah,
it-
all the time.
Right. Okay. So I'm just moving down to take some your past medical history.
Okay.
Is any other problems you have, something like that? Okay. Can you remember if anything?
I have COPD.
Right. When was it?
I've had that for about
Yeah,
6
I've
years.
got angina.
I've had that, and
I've had that quite a while.
about 6 years.
Four
About that.
years ago.
So diagnosed in 6 years ago.
Yes.
All right. When you had this last time, like if you admitted in the hospital or anything,
I did come into hospital, yes.
yeah, how many times? Since, when was
Twice.
the last? When was
About
the
2
last?
years ago.
2 years ago.
Yeah, I took a blue book
Right.
for that.
Are you taking any medication or anything
Told me
for
6 years
that?
ago I had that. Been in the hospital a couple of times.
I'm taking
2 years ago.
and I've got an inhaler to take,
Right.
bronchodilator. I just take it as and when I need it.
Okay.
Yeah, it's probably not feeling.
Any other medical problems you have? Any other?
Angina. I have
And
angina
the
as
nurse
well.
came at my house afterwards
Okay.
for a few weeks.
When was this diagnosed?
That was
I just
diagnosed 4 years ago.
Right.
Yeah, about 4 years
said
ago.
last time I went there, you said
Are you all right at the moment? Like, is the angina
no, you said you just see
problems anytime you had, in these 4 years, or is it stable?
I think it's fairly stable. They give me tablets for it, so
Get tablets for it. Okay. What you taking?
take aspirin.
Okay.
He said he'll see me after the operation.
When you feel, the pain, are you feeling arm pain, just on the left side pains anytime, when you like
It's when I
walking
start,
or
yeah,
go for shoppings
I
and
can't exercise like I used to. It's been remarkably reduced over the last 2 years. When I start exercising or doing heavy lifting and things, I start get the pain starts
Okay.
coming on.
otherwise you all right?
Yeah.
Okay.
I did a blood test as well. Yeah, so
So you said you're using some inhaler
Yes.
for your COPD and aspirin for your angina.
Yeah.
And,
And any other drugs you take?
I'm
Any
taking
other?
some steroids at the moment.
yeah, paracetamol.
Right.
And ibuprofen. Yeah, it's not very often. I'm taking a bit more now.
Okay. I'm just going to ask you about some of your social life,
Okay.
social history. Are you working at the moment?
No, not at the moment.
Right. You never worked, or you previously worked and stopped?
I did work. I used to be. I'm a bricklayer by trade. There's just no work out there at the moment.
Right. That's why. Not because of your problems.
I can't work as much as I could with it. I mean, with the
Right.
angina
Okay.
comes on, but I am looking for work. But what I can do is obviously is reduced now. So
Mhm. Are you married?
if I am, my wife would kill me at the moment if I can't remember this.
It's not that.
No.
Married. You're married.
Yes, I
Yeah,
have.
yeah, married.
I
Got
think I have a
kids?
bit of dementia, early dementia. I've been married for 31
Right.
years. I'm not going to hit 32.
Oh, you got kids?
I do. I remember them. I have 4 of them.
All right.
And they've all left home.
Okay.
That's probably why I remember them.
Do you smoke?
Yes.
We live in a house, yeah, we've got stairs.
How much?
I smoke about half to a packet a day.
Do you drink?
Yes, I enjoy a couple of lagers when I'm watching a bit of TV on an evening.
Yeah.
Helps me sleep.
What about your diet? Do you? But
I have
can
a
you
healthy
just
diet.
yeah? But can
Very
you just
healthy
tell
diet.
me like in a day what you take, like a breakfast, lunch? And
Kickstart the day. I have a couple of brews, a couple of coffees, and some toast.
Mhm.
Then have a lad's lunch, probably a burger and chips. Another brew to keep me going.
Mhm.
A little snack, probably have a chocolate bar, a Kit Kat, something.
Mhm.
During my break, have a dinner, probably pasty, chips, some beans, a bit of bread.
All right.
Sometimes maybe a pound.
You've got to treat yourself, so I'll have a little cheesecake, maybe a slice of cheesecake. Slice.
Mhm. Big slice.
I'll probably have a cup of tea or coffee or something at the end of a long day, probably.
Right. Just move on to ask something about your family side, like your mom and dad's side. Any problems or any major health problems? So any kind of problems with your parents' side?
My mum's dead. She died when she was 63. She had a heart attack, and she had some diabetes as well. When she was type 2 diabetes, I believe it was.
Mhm.
My dad, he's also dead as well. He had gastric cancer. He had blood pressure as well.
Yeah, we have potatoes, we have chips, we have
Right. Now your siblings, like sisters or brothers, anybody had any problems?
yeah.
My sister, she's on those statins and things for her cholesterol.
Mhm.
My grandmother, she died when she was quite young, when she was 45. She had a heart attack and she had blood pressure and diabetes as well.
Okay.
So not too bad at 60 then. 45.
Right. So a bit of history of heart problems in the family. Okay. Do you have any other problems? Any other your skin,
No.
your eyesight? Are you okay with see? Are you using any glass or any nothing?
Yeah. I just wear them for reading.
Mm-hmm.
Yeah. I sometimes get occasional headaches and things So I think it's just I need to start wearing my glasses more.
Right.
Yeah.
Any problems with your neck? Can you move your neck side? So any problems we had?
No, no problems with my neck. No.
You any problem? The water works all right and bowel. Any blood stains or anything with the urine?
No. I've got a bit of diarrhea, like I mentioned earlier. But
Any blood stain or anything like that? No.
No blood in
What's your urine all right? And
yeah, that's fine.
that's fine. Any pains or anything?
No.
The
no
blood,
No.
other than your normal pain, any back problems?
I have a occasional back. When you after a heavy day, and that but on the back, I sometimes get a bit
Any
of
hip
discomfort.
or
as well.
joints? Any pains?
Sometimes in my knees and the leg,
Aching
Yeah,
pains.
I'm getting old, aren't I? So
You taking any medication for that? You didn't? No. Always you're fit and healthy.
I am. I'm a stallion.
Okay. I missed anything, don't know. Okay, thank you very much for attending.
So, this was a gentleman who's or lady for pre-op assessments. But overall, what are your aims for pre-op assessment?
No, just look, I can't see really. To find out any risk associated with him going for undergo the surgery, and if he can treat before surgery and avoid complications, delays and things. That's the main aim.
What is your opinion of this patient's surgical risk status, and on what basis have you formulated this opinion?
He already got COPD and angina. That's the two main risk problems. And he's taking aspirin as well. So we need to keep eye on it, like stop on aspirin to reduce the bleeding. Like one week ago, something like that, we stop it. And COPD. It can cause problems to the surgery.
You have established that this patient has a history of angina.
Mm-hmm.
Yeah. What are the implications for this for a patient undergoing surgery? It's generally speaking, isn't it? Generally speaking, if a patient has angina, what's the implications for a patient who's going to have surgery?
They can have heart problems, cardiac arrest. And after that, they need to be ventilated. And don't know much about. Because we need to get the anesthetist opinion before that to make sure and get the ECG or treadmill and everything. Make sure it's all right.
Reminded me of normal hairy appearance. Right. Go on then. You've established that this patient is possibly hypertensive. What are the implications for this patient? Sorry, what are the implications of this for a patient undergoing surgery? So if your patient is going for surgery and is hypertensive, what are the implications for the surgery?
Patient can get a high blood pressure, lead to get a cardiac arrest or stroke, and
I'll just move on if you. You have established that this patient has COPD. What are the implications of this for a patient undergoing surgery? This patient is on aspirin at present. What are you going to do about this?
We need to consult with the anesthetist or the surgeon because each hospital have a protocol of stopping this medicine.
Yep.
Because we have 1 week, 2 weeks protocol to stop this, also to prevent bleeding. So I'll follow that.
Okay. This patient is currently taking corticosteroids. What are the implications of this prescription for a patient undergoing surgery, and what would you need to do about it?
We need to consult with the anesthetist about it because it will lead some complication, altered wound healing problems. It's related with the steroid, and so need to consult with the anesthetist beforehand and see.
Okay then. You have established that this patient may have problems with glucose homeostasis. What are the implications for a patient undergoing surgery, and what would you need to do?
Sorry, glucose?
They might have problems with glucose homeostasis. What are the implications of this for surgery, and what would you need to do?
We need to control the do you mean the diabetic problems you need to control because it's going to be a problem with the wound healing problems, getting infections and things like that, so you need to be under control.
Okay. This is sort of hemicolectomy is quite major surgery. What are the risks associated with this particular surgery?
Perforations, infections, bleeding, failure of staples that leads to perforation. Could be DVTs, PE, cardiac arrest. Okay.
Okay, that was all.
Death.
Death.
So was that question specifically to right hemicolectomy, or was that
Yeah.
just general anaesthetic,
Well,
surgical rest included?
With